Hey, Facebook Live. How y'all doing? It is Sunday. It's Sunday. Come on, welcome into the broadcast. It is now time for Rebound Your Health TV with Dr. Z. You guys know me, so I'm going to give it a couple of minutes. I might be 2 minutes behind myself, but we're going to get on into it. And hopefully we're going to learn some stuff today about nerve pain. Go away. The question mark is obviously because a lot of people have questions about, can I ever get rid of this nerve pain that I have? So we'll come on into the broadcast. When you get here, sharing is caring. I'm actually going to go ahead and click share to a couple of people here. Not a couple of people, to my page actually, to make sure that we get some good information sent out to everybody today, okay? So about a few minutes and we're going to get on started. We're going to get started. Let me see, where are we? Okay. Welcome to the broadcast. Make yourself say hey if you're here with me. And I'll say hey back. If you're there, sharing is caring. Sharing is caring. So if you get an opportunity and this information might be helpful to you or someone else you know, go ahead and click share or invite people to come and witness this with us and participate and maybe get some information that they can share along. Welcome to the broadcast. Hi, Ayana. Thanks for joining us. Welcome to the broadcast. Welcome to the broadcast. I miss you. Welcome to the broadcast. Sharing is caring. Hopefully this information, again, I said this information will be helpful. Today we're going to talk about nerve pain. And basically, what can we do about it? What can we do about nerve pain? All right. Sharing is caring. Welcome to the broadcast. Who else is there? I see somebody else there, but I can't see your name at the moment. So hopefully if you get a chance, say hey. And we're going to probably get started just in a few minutes. In a few minutes. Welcome to the broadcast. Hi guys. Hi guys. Welcome to the broadcast. It's Dr. Zarinah here on this glorious Sunday. Here to help some people, hopefully. And we're going to share some information with everybody. And if you, hi Angie. Hi, nice to see you. I haven't seen you so long. Welcome to the broadcast. I hope this information is going to be helpful, like I said, to either you or someone you may know. To the broadcast. Welcome to the broadcast. You have reached Rebound Your Health TV with Dr. Z. And today we're going to be discussing nerve pain. Go away? Question mark. Because can we actually make it go away? Can we get rid of that? So I'm going to wait just a couple more minutes and we're going to get it going. All right. Gonna get it going. Hi, Miss Sharifa. Welcome to the broadcast. Welcome to the broadcast. How y'all guys doing? I'm literally gonna give it like 60 seconds. So thanks for coming and coming to join us. Like I said today, hey Angie. Welcome to the broadcast. Sharing is caring. Go ahead and click share, share, share. I get a lot of questions about nerve pain, and so I thought this would be a very appropriate conversation to have today. And as y'all know, I'm kind of one of those people that likes to discuss prevention, how food can be medicine or medicinal, right? And then also sometimes, I see you, Miss Sharifa. You're joining our broadcast. And also some medications, of course, some that you're familiar with, some that you may. And there's some other treatment options that a lot of people are not as familiar with. So I'm going to touch on all of that. And hopefully this is going to be really, really helpful information for somebody. And if not you, please click share, 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 so maybe possibly it can help somebody else. All right. Thanks for coming, guys. Thanks for coming. So I'm going to get into it. I'm going to welcome, as you come in, like I said, welcome to the broadcast. I want you to go ahead and say hey to everybody so we know you're in the building. Welcome to Rebound Your Health TV with Dr. Z. Today is a Sunday. I don't know if I even completely know the date. I think today is September 17th, 2017. And we're going to discuss nerve pain, go away. Okay, y'all know me. I'm Dr. Zarinah, also known as Dr. Z affectionately, and I'm here to help you through my different concierge practice, my medical practice, private practice, speaking engagements, other products and services to help you guys rebound your health, and ultimately attain your pain freedom. That's what this is all about, and that's what this conversation is about as well today. Okay, so ultimately that's what we're here today, and I'm going to jump right into it. So nerve pain. First of all, what is nerve pain, and how do we define it medically speaking? To get it, not to get too sciencey, I try to like speak to the audience that of course is there, which I know all of y'all are my MVPs, so y'all highly intelligent, and they're already probably on top of a lot of this. But in general, we have muscles, right? We have nerves, we have tendons, we have ligaments, And essentially, the nerves is the neurological pathways, if you will, or the channels that allows us to feel things, physically feel things. And so when we talked about probably in the past, I think even that pain is in the brain, right? We had that conversation. But that comes from the neurological tentacles, right? The neurological signals that our brain sends from the brain to the respective body parts. And so in order for you to even be able to experience pain, experience numbness, experience tingling, these are some symptoms I'm throwing out because those are some signs of typically some classic signs of nerve pain. Then those are some things that those are kind of words that we generally hear: tingling, throbbing, sometimes sharp pain. It's another one. Guys, you can go ahead and type in the box too. Y'all guys can throw them out at me. This is a very interactive live broadcast here. So definitely don't, be shy. I don't have to do all the talking. I'll be doing most of it. If you have questions, go ahead and shoot them in the comment section. Click notifications so that you guys know that when I'm coming on next week and things like that. Sometimes it varies, but for the most part, it's always going to be on a Sunday. But if I have any changes in that, I'll always guys let you know. But if you have, what other kind of symptoms would you say that you kind of hear about? Maybe you yourself, Ayana or Ms. Sharifa or Angie, are experiencing some kind of nerve pain. I know other people who do. What kind of words do they use? But those are the most common ones. It will be tingling and sharp pain and sometimes numbness. A numbness kind of pain can also be experienced by people, and they use those terms as well. So that's another terminology. Okay. So those are, but essentially, like I talked about, is a channel, nerve pathway that goes from the brain to respective parts of the body. You can have it in the skin. You can have it in the muscles. Nerves pretty much go everywhere in the body to give us that sensation, so to speak, of either pain or numbness and other types of feelings as well. Okay, so that's kind of just generalizing, of course, what are nerves in a general sense. And then we break that down in terms of nerve pain. We break it down to traumatic and non-traumatic, okay? And even break it down further from there in the non-traumatic category. You have some things, offenses that are metabolic, which essentially means, for instance, like diabetes, for example. That's a metabolic phenomenon that can result in what they call diabetic neuropathy. A lot of people, you probably know somebody personally, or some of you out there may have experienced it yourselves with diabetic neuropathy. So that's something that that fits in that non-traumatic category. And then you have trauma. Okay, you can have trauma to the nerves. And when that happens, essentially it could be examples of, it could be athletic injury. Some of my athletes who have neurological damage to they broke their shoulder, and now the nerve pathways that go through the shoulder could be affected. Back pain and neck pain. Sometimes we get what we call radicular symptoms, and what you guys, my patients commonly refer to as sciatica, right? Or they may refer to as a shooting pain, where it travels down the arm or travels down the leg or travels down the buttock. That can be sometimes related to a neurological issue. Sometimes it's actually a referred pain pattern, which we've talked about in different series, and we could talk about that at a different date as well. But definitely that fits in that category as well. Okay, so we got a traumatic, we have that non-traumatic. So moving on from there, what do we want to talk about? Basically, what is preventative things that we can do to prevent neurological or to promote neurological health? Let's say it that way. And so I'm gonna give you my big three, right? The big three only because they are super antioxidants, and antioxidants are very critical in ridding our bodies of free radicals and those damaging things in our bodies that create issues to our neurological health. And one of those are being, almost look like that fast, CoQ10, for example, okay? CoQ10, I call it ALA, alpha lipoic acid, which is my number 2. Somebody write these down for me if you're still there with me, you're joining me. Welcome to the broadcast. Come on in. Sharing is caring. Share. Come on into welcome to Rebound Your Health TV. Come on to the broadcast. If you're still there with me, someone, you can type in, even if it's spelled wrong, we'll get the point. Alpha lipoic acid. Thank you, Ayana. Thank you for joining that. CoQ10 is the other one. And then the third one is hydroxytyrosol. Fancy word, but some call it HT, like around whatever, if you kind of get fancy with it. But hydroxytyrosol, that's hydroxy, Tyrosol. Okay, so those are the big three, and I'm going to break those down a little bit further. So essentially hydroxytyrosol, let's start there, right? That's considered a really big, powerful antioxidant. Our bodies don't necessarily naturally, well, they can naturally produce that, but thanks, Ayana. You're awesome. Thank you for participating, getting that in there for everybody else. And that third one, I see CoQ10, hydroxytyrosol, and that third one is alpha lipoic acid. So the lipoic part, of course, is LIPOIC. So alpha lipoic acid. So those are my big three. So anybody joining us or they join us later or may catch this replay and you see some of these notes in the comment section, that's going to be helpful. You kind of could be able to grab those words and maybe do a little bit more research, or just, of course, I'm going to give you some nuts and bolts about them here, how they can be helpful in your neurological health, either in prevention or helping you in your current state. Because some of you, and again, I'm keeping it in the line of, I'm going to break down those three in a second, but some of you already have some neuropathy or nerve pain. So you might be like, well, how do I'm kind of past prevention, right? It doesn't mean that these three super antioxidants are not going to be helpful. You can use these oftentimes in adjunct with your current medications that you're using for your nerve pain. Now, I'm not making that specific recommendation to any of you that are watching me right now or listening to me, but I am saying discuss that with your physician, your current physician, or you can also obviously give us a call to kind of discuss and set up a consultation with us, so that we can kind of tease that out if that would be appropriate for you. If you're currently on some nerve pain medications that are more, prescription strength medications, can you safely also add some of these supplements into your regimen to further minimize your pain, or again, getting you towards your pain freedom, right? Obviously, right? MVPs. So awesome, Ayana. Thank you for participating in that and getting that down there for everybody who's going to be joining us. So again, going to the hydroxytyrosol. There's a lot of research that suggests, let me back up one second. If I fall asleep and my arms and hands are always asleep when I wake up, is that a form of neuropathy? Typically, yes. There can also be something that they call, I just went blank. I'm gonna go back to it in a second. But yes, typically that's a sign of neuropathy. And the reasons for that could be multiple reasons. Sometimes it is positional, sometimes it could be related to the position that you're sleeping in. Sometimes it can be, again, related to metabolic, like there's a metabolic or chemotactic, responses happening in your body. Could be hormone related as well, actually. So that's why that's a great question, and thank you for asking that question. I would say typically yes. When you wake up and you kind of feel like you got to shake it out, that's a sign of some kind of neurological offense, or some kind of neurological phenomenon happening. And there's definitely a workup that is in play for people like that. And one thing that you can naturally do, like I said, and I'm about to further define these super antioxidants further, such as a hydroxytyrosol, starting with that. And a lot of research does suggest that it's 15 times more potent than even green tea when it comes to its abilities to knock out free radicals. That's pretty powerful, right? I think that's kind of impressive. Now, of course, you can find some research to debunk that. But the idea that for all intents and purposes, it's still a very powerful antioxidant, regardless if it's competing or not with green tea. You can't really go wrong with either of those. But the idea that is very potent, and if you really need some bang for your buck, if you will, hydroxytyrosol can be very effective for a situation like that. Hi, Dr. McKee Williams. Thank you for joining us. Thank you for welcome to the broadcast. Welcome to Rebound Your Health TV with Dr. Z. Sharing is caring, so if you found this information helpful and useful for someone, please like our page as well as follow our page and go ahead and click share to this video down below. So that's the sense of a hydroxytyrosol. Another thing, interesting thing about it is that it's also 3 times more potent than CoQ10. And I'm going to talk about the importance of CoQ10 in a second as well. The other thing is, as we talked about, it neutralizes free radicals. Okay, it increases the oxygen in our blood flow to those nerves that we need. Hence, obviously, promoting nerve health. So that's the idea with the hydroxytyrosol, and also it does decrease inflammation. I know I love to knock out inflammation because that's such a big deal when it comes to pain. Not all pain is due to inflammation, but a lot of us are walking around with this inflammatory state in our blood system, in our organs, in our system, and we don't realize it what we're doing. So these are some things: hydroxytyrosol, alpha lipoic acid, and CoQ10 are very powerful antioxidants that we can use to debunk those kind of free radicals. So this number 2, so we talked about hydroxytyrosol. Number 2 would be alpha lipoic acid. And that is a super antioxidant. You might even, some people just walk around calling it that, or ALA, or super antioxidant, because it's also very, very powerful, because it increases the blood flow to the nerves. It increases oxygen to the nerves. It zaps, or really, really powerful in knocking out free radicals. It also increases energy, actually, as well, as does CoQ10, or coenzyme Q10, which I'm going to talk about that a little bit more. So some examples of ways that you can implement ALA, or alpha lipoic acid, would be like broccoli and spinach. They're very potent in that. Question here, can I get the HT at a regular store? Regular store, probably not. Although I think I've seen it in the Kroger section of the natural section now, that they have a natural section. But otherwise, if you have a Sam's membership or something to that effect, or your natural food stores, that's where you're gonna pretty much find your HT, your hydroxytyrosol. Great question. That's probably the best place to go. Your local natural remedy store. Of course, you have vitamin shops and things like that. There's a bigger brands. The pricing, I always compare to shop in general, because as y'all all know, supplements in general are not FDA approved, or they don't have FDA approval. That doesn't mean they're not potent and helpful. So my idea is that do your research. Do I use one specifically? Not particularly. Hi, Dr. Rashana. Thank you for joining us. Welcome to the broadcast. Welcome to Rebound Your Health TV with Dr. T. Welcome to the broadcast, and sharing is caring. So click share, share, share. Hopefully this can be helpful to you or someone else as we move forward, and some people can catch this on replay. That's a great question, Ayana, as well, of course. But most likely you can find it your regular natural food stores or natural food section. Pretty much, it is pretty ubiquitous, though, in terms of you can find it a lot of places, okay? But back to the alpha lipoic acid, you can indeed get that through your food. Again, food is medicine. So you can get that through broccoli and spinach, kind of those dark green foods that will be very helpful in terms of, getting that, implementing that for your nerve health, okay? And then the third one, number three, so we talked about 1, 2, and now we're on number 3. Number 3 was our CoQ10, and that is also a very potent antioxidant that is helpful and very effective in nerve health and in helping promote the neurological health of your nerves. It's been a lot of research that supports. Actually, I'm going to back up to ALA. There's been some research that suggests that taking ALA, or alpha lipoic acid, 3 to 5 weeks in one of the clinical research articles, that 3 to 5 weeks in a patient that has diabetic neuropathy, that it tremendously reduced their neuropathic pain. They were still taking their regular prescription medications, but indeed that was very effective for them. So that's something, again, I try to give you guys the research and the evidence-based medicine as well, okay? This is not just coming off of the dome of Dr. Zarinah. This is highly, I don't just give you guys anything, because I don't want you guys to just, again, Google. Dr. Google is not everybody's friend. So anyway, that's something that I thought it was interesting fact to kind of understand or know, that the research is out there and it is supporting this information that I'm discussing, okay, today. So did I have another question there? Okay, so back to CoQ10, again, it does naturally reduce the free radicals in your body. It also increases blood flow to the nerves, the oxygenation to the nerves as well. And it increases our energy. Some people use it actually primarily for trying to improve their energy. But indeed, it's actually very, very effective in promoting the neurological health of your nerves, okay? So that's the food is medicine part of it. Our bodies do naturally produce CoQ10, okay? However, caveat to that, if you're my age, a young spring chicken like me, then indeed, as we age, the point is that our production of CoQ10 does start to diminish. So it is important that you understand that, so you make sure that you know what things to do to implement that into your regular, diet, so to speak, or getting it in a supplement form. Okay, so that's the point of that. Now moving on to treatment. So that's prevention, right? And that's also prevention. So those 3 things were about prevention, and then those 3 things also about adjunct therapy, so to speak, adjunct supplementation that you can be doing along with your current neurological medication, if it is warranted or approved, so to speak, by your regular physician. So just make sure you check in with your regular doctor if you're interested in taking these supplements, because you still want them to know if you're interested or thinking about taking, adding something to your system, that they know what it is, just to make sure there's no interaction whatsoever with the medication that you're currently taking. And of course, the idea is eventually you can start to reduce those other prescription medications and taking these natural or naturally found things that that your body needs anyway, right? So that's the point there, okay? So additionally, we talked about that, so that's prevention and also potential treatment, so to speak, or helping minimize that and ultimately going towards what? Pain freedom for my MVP. And then thirdly, or third part of this conversation is treatment. What's out there to help treat this pain? Some of you are already probably aware of some of the neurological medications that are out there. Some that include what they call gabapentin. Some of you might have heard of it as Lyrica, or I'm going blank today, but Lyrica is a very common one, okay? That is used for, or Neurontin, thank you. Well, my brain just came in. Thank you, brain. Neurontin or Lyrica, that can be helpful with some people with neurological pain, okay? You take Tegretol. Yeah, that's actually effective with, that's less used in, Tegretol is less used in diabetic neuropathy. So I would assume that you're probably not taking it for diabetic neuropathy. However, yes, so some people take it for that, relates to some kind of facial pain or a different kind of other neurological pain that may be related. Some people even take, some of my patients have fibromyalgia, right? And you think of muscle for that, but sometimes they have to take some neurological medications that can be effective with helping with that. And you can discuss that with trigeminal neuralgia. Yeah, definitely, exactly. That's effective for a lot of people with that one. And I hope it's effective for you too. But again, adding, hi, Michelle, thank you. Welcome to the broadcast. Welcome to the broadcast. It's good to see you. Welcome to the broadcast. Come on in, come on in, come on in. Cymbalta, exactly. We use Cymbalta, Dr. Rishana, for some of our patients who have fibromyalgia, but that neurological kind of pain symptomatology that comes with that for a lot of our patients that have myalgia type of pain, but it also has a neurological component to that. So absolutely. Welcome to the broadcast, Shell. Thank you for watching and thank you for coming. So those are some medication options, right? And we talked about some supplement options, right? And now I want to discuss actually kind of the meat of what I really wanted to get at is the kind of options that people don't know about. It's just not out there in the general public, but in my training, in my batch training, and very fortunate to have trained with some of the best physicians in the country. And I would even brag to say in the world, as we treated our Olympians, we treated our NFL players and our NBA players with what we call regenerative therapy as well, which also is perineural therapy. And what is perineural therapy? Perineural therapy is another type of treatment that can be beneficial for some patients. Some of you may be candidates for this, where essentially it was going to do is treat the nerve pain, that kind of pain that you can almost touch. Because what happens is the nerve does run through the, I see my signal is trying to mess with me. Anyways, the nerve pain does, the nerves go through what they call a fascial plane or fascial zone. And fancy word, essentially that's that connective tissue. And in that zone is where sometimes there's neural inflammation and swelling of that nerve in those zones. And that can be very painful for many of you, okay? And so that's the point of where the perineural therapy comes into play. Again, very effective in a lot of patients, greater than 90% effective and oftentimes immediate relief. It doesn't use lidocaine, but indeed it still has high relief. There's different substances that go in there. A common one that we use is a dextrose solution with a saline solution mixed in that. It's kind of very effective. And that can be used for back pain, guys. That can be used for neck pain. It can be used for knee pain, shoulder pain. These are very effective. And is also fairly natural, very minimal, if any, side effects other than the, just you not liking me for maybe a little soreness of from the injection therapy itself, but no more pain than you were probably already in, for sure. So it's very effective in that respect. It's been around basically back in the 1900s, early 1900s, I would say, back in Germany. And it's, of course, carried over in a lot of our professional athletes quietly, not so quietly within our field when, we're part of it, but definitely it's a very, very effective treatment that can be, again, an adjunct in some cases to what you're already doing. The name of the game, as I often tell people, is a game changer. That's right, Dr. McKee Williams. It's a game changer. The main thing I try to press upon a lot of my patients is to realize and understand that ultimately, a lot of times when it comes to us rebounding our health and obtaining our pain freedom, it's not always does it come in the form of a pill. It doesn't always come in the form of an injection, or it doesn't always come in the form of just one thing. Sometimes you have to use a combination of things, and that makes sense because as a human body, right, this machine that we're trying to build and make sure that it's performing for us, we're made up of a lot of things as well. You don't have one organ in your body that just makes everything work. You don't function without the whole body, like the whole team. So sometimes, oftentimes, treating pain and obtaining our pain freedom and rebounding our health is going to come in the form of adjunctive therapies and treatments and coming at it from a multifactorial perspective, okay? But the name of the game for what Dr. Zarinah is trying to bring to you is that the idea that I'm trying to empower everyone that hears my voice and give you the information so that you can make educated decisions so that you can ultimately long-term rebound your health with natural things as much as possible, okay? But I'm also here to say that sometimes you have to do an adjunctive. That's the whole point. One size doesn't fit all, okay? And at the end of the day, sometimes you need both, and that's okay as well. The goal is also to be on as little as possible so that you can have wellness without pills, However, sometimes that's necessary to get you to where you need to go, and that's okay too. And I don't want you to beat yourself up about that. That's the kind of thing that comes from me, is that I'm kind of like twofold. Hence, I am an osteopathic medicine physician, which essentially means I treat the whole person. I treat the whole body. And that's something I've been passionate since I was a little girl. If you ask anybody that knows me, I always wanted to know, how do you treat the human being? Regardless of what they say the symptom is, oftentimes you have to address the mind, the body, and the spirit to get to that pain freedom. And I mean long-term freedom, okay? It's about lifestyle. It's about commitment to yourself. And it's about understanding and having the education so that you can empower yourself and be your what? Y'all say it with me, your own MVPs, okay? That is what it is all about. We have to do that for ourselves. We deserve that. And your body has rights over you too. And by the way, many of you who see me in the office, you know I say that quite a bit. Your body has rights over you. So if you don't give your body its rights, it probably will take it. It's going to do everything it can to reclaim its rights. So when we don't treat our bodies right, what happens is it will manifest itself in some way. Often it comes out in the form of pain or stress or pain or pain or pain, physical pain. You get my point? So we have to make sure that we're, when we have stress, because you can't always eliminate it, right? You need to know what things can I be doing that are going to debunk that stress? What things can I be doing to either prevent the pain or minimize my pain? That is what this is all about. So let me go to questions and see if there's anything that, yes, game changer, true MVP, absolutely. Everybody out there that hears the sound of my voice, you are an MVP. You are your own MVP. When you walk in that room, you're the most valuable patient in that moment in time for me, okay? And you're the most valuable person in your life. That's what MVP has a double meaning to me, which is why I use it so often. You're your own MVP. I'm here to remind you of that. So when it comes out of your mouth, you believe it. Because when you walk through my door, I already know it. And I'm just there to kind of help you get to that space where you claim that as well. Every day in the morning, you look in the mirror and you tell yourself, I'm the MVP. Okay? And own that, because that's the truth. But I can't give it to you by myself, but I do need to bring you along. And ultimately, that's what I'm here to do, is take you along this journey to get you to where you need to be, because it's not about me anyway. Really, I got the ball assist. I'm going to be there to kind of take you guys where you need to get. I'm not going to give up on you, and I need you not to give up on yourself. And those who know also see me in the office, I give you homework, which is what? Accountability. That's all it really means. I have to be accountable. You have to be accountable. So when you come into our office, you want to see Dr. Zarinah, it's about that relationship. And I'm going to be loyal to you. You need to be loyal to your body. That's what that's all about. Rose, Ned, can I quit my job? Absolutely, you cannot quit your job. No, Dr. Ashar, you cannot quit your job. That's not what this was about. This is about being your own VP in every aspect of your life. I want you guys to be able to not let your job be the hazard in your life, but you're going to be implementing things in your life to make sure that you're doing things that are healthy. They're going to be bring you wellness. So then in spite of your job, that you're also implementing wellness activity and tips and things like that that I try to bring you all through different media and different platforms, that you're going to be obtaining that as well. Okay, so no, you can't quit your job, but you're going to just keep going. Okay, MVPs, that's what you got. I want to alleviate stress. Well, that's what we're talking about, and I can bring another video to you guys about some things to reduce stress, because that's important, and that's part of what we discussed actually in the office. Again, I've talked to you guys multiple times, and probably like a broken record, but I want to impress upon you, like when you come off and you have a shoulder pain or knee pain, a back pain or whatever, we're going to talk about that pain, but ultimately we're going to talk about what are the things that are non-physical related that are affecting that pain, that's triggering that pain, that's exacerbating that pain. That's important. If I just glaze over that and throw a pill at you, I'm doing you a disservice, okay? Now, sometimes you do get a pill. Sometimes, again, I have to write a prescription for certain things. But ultimately, my goal is to put the power back in your hands and remind you that that's exactly what you have. You have the power. You are the MVP, the most valuable patient in that moment in time and the most valuable player in your life, all right? Let's get to these questions, and I'm going to wrap it up. If any more questions, if not. Excessive stress can increase my blood pressure, which causes my neuralgia to act up. Absolutely. And that's exactly why I impress upon everyone so much that at the end of the day, if you're not addressing the psychosomatic, the mind aspect of pain triggers, that your physical pain, you're just going to be in this hamster wheel. And when we as physicians that are in pain management, and we're in this pain field, if we're not addressing that aspect of it, then again, we are doing a disservice. Some of you coming, you're not really willing to or want to. That's okay too. I'm gonna try to get you there, but you do have to. I can't do it for you, but I'm gonna definitely give you every single thing in me to make sure that you get to the place you need to go. You just gotta meet me halfway, okay? So these are great questions and great comments, okay? So as a recap, and then we're gonna tie up. We talked about prevention as far as it relates to nerve pain and neurological promoting neural health. That was alpha lipoic acid. That was hydroxytyrosol, and that was also CoQ10. Okay, and the rehash with that was a very potent antioxidant that promote nerve health and essentially knock out free radicals and can help alleviate pain. Namely, we talked about even the alpha lipoic acid, where researchers suggest and studies have shown that diabetic neuropathy patients, for instance, they take it for 3 to 5 weeks, that they greatly reduce their neuropathic pain. Again, this is not something I'm telling you to do only alone without the guidance of your regular physician. Or of course, if you don't have that, you can give us a call, or you can follow us on like and share our Facebook page, or give us a call at 678-902-4746. That's 678-9024-RIM, R-I-M, okay? And I'll give you some more information at the end of this video. And certain foods increase inflammation and pain in neuropathy. Yes, and that was part of, I think, some other videos, and I'm gonna make sure I'm being posting these. If you follow my YouTube channel as well, you can just click on the subscribe to my YouTube channel, and there's some videos in that, on that YouTube channel that actually discusses food that can cause inflammation. But I may need to do a separate video that's really dedicated to that, because that video wasn't dedicated to that. But some food, for instance, if it's high in, like high dairy content, can be very inflammatory, Dr. Shara. As well as, did I miss a question? Chronic depression, anxiety can increase your pain. Yes. Lack of sleep can increase your pain. If you're not addressing your depression or your anxiety or your sleep, your pain will be exacerbated. If you're not addressing also neuropathic pain, since we're talking about nerve pain, of course, if you're a smoker, it increases your pain. So I always try to get people to join, like part of my treatment program or plan with you are going to be to get you to stop smoking. And we're going to implement things to try to get you there, because we're going to, again, be on a hamster wheel if we're not addressing that. I'm just kind of throwing water on a grease fire. That's not good. Okay, we got to address those things. And smokers, we know for a fact that smokers have exacerbated and increased pain compared to non-smokers. Okay, so that was a great point, Dr. Rashana and Dr. Shar. And then, yeah, by anxiety, sorry, I missed that. You will watch. Yeah, I probably need to do another video about it. Actually, that was dedicated to that because I haven't done that too. Yes, drinkers too, Ayana. Yes, drinkers too. Meaning drinkers. They for anybody who's listening, drinkers meaning high alcohol content where you kind of drink fairly regularly, and that's all debatable, right? But if you're drinking every single day, or you binge drink even, those can be definitely exacerbating things for your neuropathic pain symptoms. Okay, so those are great questions, great comments. Keep them coming. But yes, I wanted to reiterate the point about the pain. Food, things that can increase your pain as far as inflammation. Dairy things can do that. Of course, greasy, fatty foods can do that because they, of course, don't have really any content in there. If you're gonna do it, I know French fries. Who doesn't like a French fry? I like a French fry every once in a while too. But it has to be a treat, right? It can't be I eat French fries 2-3 days out of the 7-day week. It has to be a treat. Just like red meat can be inflammatory. You have to be really careful about your red meat content because that can also be not the best thing on a regular basis. I also personally believe that red meat should be a treat. And when I say treat, my definition of treat personally is like once a month, maybe twice a month, but like not often, okay? Not once a week or anything like that. Sorry for anybody who, red meat lovers, but that's just what it is, from the science perspective, at least for my kind of neurology. Yeah, exactly. And another great point about neuropathic pain is water content, okay? Making sure that you're drinking a lot of water. It sounds minimal, but at the end of the day, water is a life source for us all. So you want to make sure that you're doing that as well, okay? Dairy, fatty food, French fries, exactly. Thanks for participating. You guys rock. My MVPs rock. Y'all MVPs rock. I love the participation. Yes, so anybody coming in at the tail end of this, they can go to the comment section and kind of be able to synthesize this information a lot quicker because they'll hear it, they'll see it, and they can be able to pull that out. Definitely, if you guys have questions further that go beyond what was been asked in this video at this time, feel free to go to the comment section below, or you can even email us at info@drzarinah.com. That's info@drzarinah.com. So if you want to email us information. Also, if you would like me to come and speak, any speech engagement, we also are booking for that as well. Again, also at info@drzarinah.com. That's info@drzarinah, DRZARINAH.com. All right. Please go ahead and like and share our page. That's also at www.fb.com/Dr. Zarinah. Everything on social media is Dr. Zarinah. But that'd be great. If you guys have any further questions, that's how you can reach us to get more information or get more input. You guys have been fantastic as usual. You guys are my MVPs. I hope this information has been useful for someone. If not useful to you, hopefully you can share it. Sharing is caring, and hopefully that will be a caring thing to do for someone who may be suffering or not sure what are the natural things they could potentially do to either prevent, to adjunctively use with their current regimen, or not realizing that there's even other treatment options that the main common doctor, they don't do them or they're not as well aware of it, okay? So that's important as well because you have to go to a very highly trained, specific physicians that understand this kind of pain and understand all of this different kind of treatment options. And that's what I love about what I do is that I have a traditional component and a quote-unquote non-traditional component. Hence, I'm your sports medicine and integrative medicine physician when it comes to your pain freedom, okay? So once again, I'm Dr. Zarinah, also known as Dr. Z, here to help you through my different practices, my medical practice, I should say, concierge as well as traditional practice, as well as speaking engagements and other groups of products and services to help you ultimately obtain your pain freedom and ultimately help you rebound your health. You guys are my MVPs. You're your own MVPs. You can reach me again at info@drzarinah.com if you have any further questions or like booking information or as relates to any speaking engagements. I'm going to see you guys next week. You guys have all been awesome as usual for joining in at Rebound Your Health TV with Dr. Z. I'll see you guys next week. Mwah, 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 mwah.